I'm Dwayne Brown. Tonight on KPBS Evening Edition, more questions about a $5 billion pact to shut down San Onofre for good.
All of this was carried on massively behind closed doors, with the public having no input whatsoever.
Next, the trail of clues from the Golden State to Poland that some say may have helped shut down a critical investigation.
Could cancer be treated as a chronic instead of deadly disease? Where is cancer research headed? I'm Peggy Pico with an update on cancer advances in San Diego. And how will the new changes to Jessica's Law impact San Diego neighborhoods? And why some victim advocates support the easing of housing restrictions for some sex offenders.
The cleaning, the playing, everything is just like your domestic cat at home, just in a bigger package. It's a little bit more dangerous.
Cute and clumsy, meet the newest addition to the San Diego Zoo. Why zookeepers are still waiting before they name it. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. New details tonight on a review of the San Onofre nuclear plant in the North County and faulty equipment that forced it to shut down. Regulators say they plan on closing the case. The environmental group Friends of the Earth wanted the Nuclear Regulatory Commission to review whether Southern California Edison sidestepped rules when it replaced steam generators in 2009 and 2010. In today's proposed decision, the group says the issue is no longer relevant because the plant is closed. A deal to close San Onofre for good left consumers stuck with most of the bill. Now there are calls to scrap the settlement. KPBS investigative reporter Meetha Sharma says this after recent disclosures the genesis of that agreement may have been hatched in secret.
Sorrentino's pizza owner Patrick Quinn says he's tired of watching his energy bill go up each month.
2011, 2012, say May or June, the bill was running around $1,390, $1,400. So this past year, 2014, like last summer, it was running $2,230, $2,250.
Quinn says he tried to cut his energy consumption by closing his restaurant between 3 and 4 p.m. each day. He turned off his ovens. He even shut down the pilot lights. The result? He says his power bill actually increased by $1. Resignation has now set in.
What are you going to do? You know, we're slaves to the utility industry.
To bolster his argument, Quinn points to the steam generators at San Onofre in 2012 that broke down just 1 year after they were installed, and the subsequent $4.7 billion settlement that requires customers to pay for most of the plant's closure costs. He calls that settlement illegitimate because the California Public Utilities Commission allowed it without a full investigation of who was responsible for the plant's failure and who should be held accountable.
There should be an investigation. Who designed the steam generators? What company designed those and the installation? And why did they fail? You know, those are simple questions that should be asked.
I'm not here to answer your questions.
Former PUC President Michael Peavy was still a powerful bureaucrat unaccustomed to being challenged during this hearing last May. But former San Diego City Attorney Mike Aguirre wanted to know just how did the PUC reach the $4.7 billion settlement with little public input. So Aguirre asked Peavy how many times he had talked privately with executives from San Onofre's majority owner, Southern California Edison. Peavy, a former Edison executive himself, wasn't having it.
I'm not here to answer your goddamn questions. Now shut up.
Hindsight has brought clarity on Peavy's outburst for Aguirre.
He really blew up, and of course now we know why.
Just 1 year earlier, Peavy met with an Edison executive at the opulent Hotel Bristol in Warsaw, Poland. They discussed a framework for the settlement agreement on San Onofre. The launch of those talks effectively put an end to an investigation promised by the PUC into who was responsible for San Onofre's closure and whether customers customers should still foot the bill for a plant no longer generating electricity. That Poland meeting also came to light nearly 2 years later, after state investigators found notes about San Onofre's defective replacement steam generators on Hotel Bristol stationery during a search of PV's home in January. PUC officials and utility executives are the target of both federal and state probes for alleged inappropriate contact and possible influence peddling. What's more, Edison never reported the secret meeting to the PUC as required until after UT San Diego published a story about the seized notes. The company explained the 23-month delay by characterizing the Poland talks as an update on San Onofre that was, quote, permissible and not reportable. But the company goes on to say it now appears the executive may have crossed into substantive communication. Aguirre believes there's another reason for Edison's belated notice.
But once they were caught, they released it.
All told, PUC officials had scores of private meetings and other contact with the executives at Edison and minority owners San Diego Gas and Electric about San Onofre since the Poland talks. There were also email exchanges. Commissioner Mike Florio discussed the root cause of the tube leak at San Onofre and refers to his, quote, regular Wednesday call with an Edison manager in an email. A PUC spokeswoman says those calls with Edison dealt with the immediate aftermath of the San Onofre outage and concerns about reliability if the plant couldn't come back online. But Aguirre says the private contacts between regulators and Edison went beyond engaging with industry to be responsible leaders. It became more about cutting a deal.
This was carried on massively behind closed doors, with the public having no input whatsoever.
Edison declined a recorded interview, but in a court filing, Edison echoes the PUC's contention that the company and state regulators had to maintain contact after a large nuclear plant goes out of service for updates and to ensure reliable power supplies. Aguirre calls that explanation a cover to hide the clandestine maneuvering to settle a case that demanded a probe by the PUC.
It wasn't a settlement. It was a plan to end the investigation.
Aguirre says there was plenty to investigate. Records show Edison knew there were concerns about design flaws with the new steam generators before deploying them. A radiation leak in one of those generators in 2012 ultimately forced the plant's shutdown. Nuclear safety experts say Edison also failed to go through the proper licensing process with federal regulators to install the new equipment. And Edison never got permission from the PUC to put the new $700 million equipment into customer rates permanently, according to documents. Taken together, Aguirre says the facts scream for accountability.
This is one of the biggest white-collar crimes ever.
Meanwhile, there are calls by state lawmakers to throw out the San Onofre settlement and to force Edison to turn over emails related to the deal. New PUC President Michael Picker has pledged reform, but there is no word yet on whether the regulator will compel the company to release the emails. Amita Sharma, KPBS News.
San Diego health executives are calling it the primary care cliff. A key federal funding source for safety net clinics is set to expire in September. KPBS reporter Megan Burks joins us from the newsroom with more on this story. Megan, what do they mean by the primary care cliff?
Well, community clinic executives are back from a week of lobbying in the nation's capital. They want Congress to extend the life of an $11 billion trust fund that's set to expire on September 30th. Former President George W. Bush created the fund to grow the nation's network of community clinics, and that funding was renewed under President Barack Obama, so these low-cost clinics could bear the weight of the new Affordable Care Act patients.
So growing community clinics, what's being done to keep it from expiring?
Well, the House of Representatives passed a bill Thursday that would extend the funding another 2 years. It's part of a larger package that would also stabilize Medicare payments to doctors. The bill's next stop is the Senate. They'll be back in session in mid-April.
And what if the Senate doesn't pass the bill?
Well, I spoke with Policy Director for the San Diego Council of Community Clinics, and he told me if the funds were slashed, area clinics would have to cut 1 million staff hours next year. He said that would make it really difficult for patients to get appointments.
Now, Megan, you mentioned the Affordable Care Act. Don't clinics have more patients with insurance to cover their costs these days?
That's true, but the Council of Community Clinics says it's only intensified the need for federal funding. These clinics are in the neighborhoods where a lot of low-income San Diegans who got the new coverage from health reform live. So their waiting rooms are packed, and many of the patients are on Medi-Cal, which has lower reimbursement rates. So clinics often must eat the remaining costs.
KPBS reporter Megan Burks. There is a new trend in the types of jobs held by people who are living in the country illegally. A study by the Pew Research Center says they're more likely to be white-collar careers. This includes managers, architects, even doctors. Immigration experts here in San Diego say better education is one reason. Honoring the life of Cesar Chavez, San Diego will celebrate his legacy fighting for farm workers' rights with several events. As KPBS reporter Matt Bowler shows us, a breakfast in his honor marked the 1965 Delano grape strike.
Organized with dignity, respect, community, and solidarity.
Hundreds came out to remember one of labor leader Cesar Chavez's most famous fights.
So we can change the world.
50 years after the Delano grape strike, organizers say their movement has gone global. Paul Chavez, Cesar Chavez's grandson, credits his grandfather's forward-looking nature with the longevity of the United Farm Workers Union.
He had the vision to understand how collaboratively working together, you have power and you have strength. And the base of that comes from organizing and collective bargaining. But he took that and introduced the civil rights movement.
Chavez says his grandfather's fight continues today, and there are parallels between the 1965 Delano strike and the farm workers' dispute in Baja today.
Many of the issues are the same. Being underpaid, being mistreated, the sexual harassment of women at the workplace, the utilization of child labor.
United Farm Workers is carefully flexing its muscle on the labor conflict across the border.
The UFW, my uncle Arturo Rodriguez, who's president of United Farm Workers, have taken an active role in reaching out, trying to organize and participate with what's happening in Mexico.
History repeating itself.
They're not issues that are new. They're not issues that are just within California or Mexico or China or Eastern Europe or African nations. It really is a global issue.
First brought to light more than 50 years ago. Matt Bowler, KPBS News.
And for a list of events commemorating the life and work of Cesar Chavez, go to kpbs.org. Tonight at 9, we will air part 1 of The Emperor of All Maladies. The documentary traces the history of cancer, treatments, and modern research. Peggy Pico takes a look at cancer research and advances right here in San Diego.
Even with significant advances in understanding and treating cancer, the disease remains the second leading cause of death in the U.S., killing more than 500,000 Americans each year. Joining me with an update on cancer advancements in San Diego are my guests, Dr. Razel Kurzrock, Director of the Center for Personalized Therapy at Moores Cancer Center, and Dr. Maren Xavier, oncologist at Scripps Clinic in Hillcrest. And Dr. Kurzrock, surgery, chemotherapy, radiation, those are traditional ways to treat cancer. What are the most promising new ways to treat cancer?
The most promising new ways relate to immunotherapy and genomics, and this relates to personalized therapy or precision cancer therapy. So genomic medicine and immunotherapy encompass both precision in that the therapy is very precisely attuned to the tumor, and personalization in that each tumor is different and that we customize therapy for each patient.
Sure. So rather than, if I get this right, rather than just saying, oh, we're only treating breast cancer this way or this cancer, that you look at the actual tumor. Can you give us an example of how immunotherapy or personalized medicine has helped one of your patients?
So I want to go back a few years when immunotherapy was still in its infancy, and we were working with a new drug that is now FDA approved called ipilimumab. It was not approved. It was experimental at that point. And we had a melanoma patient that had very advanced disease, received ipilimumab, and we didn't yet know that immunotherapy was quite different than chemotherapy. After 2 months, the patient had progressed and unfortunately was really end stage, so we sent him to hospice. He felt better after a month in hospice, came out, and then after another month was really feeling better and came back to us, and he was in a complete remission. Now, I don't want to give people false hope, but we now understand that there is a subset of patients with immunotherapy, even with end-stage disease, that can have long-term remissions, maybe even cures, and that furthermore, they may show that the disease progresses before it gets better. Very different than chemotherapy.
It's certainly different on the monitoring with that. And Dr. Xavier, how has cancer treatments changed since you started practicing medicine?
So what's interesting is that the series that airs tonight was written by Sid Mukherjee, who is a fellow, and I was a fellow, and so even since then, in the past 10 years since we were fellows, it's been so amazing, all these new tools we have. We have immunotherapy now, 3 at least agents that are on the shelf that we can prescribe for our patients. And then we have this whole other field, which is called targeted therapy. And I think that's really where we're on the verge of major, I'm convinced this is, once we learn how to properly implement using targeted therapy and testing for those targets, I truly believe this is going to be a new generation of cancer treatment.
Sure. Let me follow up with this, though. So still 500,000 lives every year are lost to all forms of cancer combined. Why is it so hard to find a cure?
Yes, we are very far from winning the war on cancer, and I think that it's very humbling to realize that although we've come so far, there's still so far to go. Cure is the goal for cancer, and unfortunately, when we have late stages, we're not able to promise the cure to our patients. So my hope is that as we get more fine-tuned on testing and targeting these mutations that drive cancer, we will be closer and closer to the cure.
Sure. So we're talking about a cure here, but Dr. Kurzrock, what about the idea that I've heard floating around for some time now that cancer could be treated like a chronic disease, maybe managed like diabetes? You manage it, you live with it. What do you think about that?
I think as a first step, as these therapies emerge, especially for patients with advanced metastatic disease, we're going to need to learn to live with it as a chronic disease and to keep on treating it. But there's also another way to think about it, and that's to bring some of these new therapies earlier in the course of the disease. And there, if we step in earlier, I think there's much more hope that we might be able to eradicate the disease as well.
All right. Well, Dr. Kurzrock and Dr. Xavier, thank you so much.
Thank you.
Thank you.
Coming up tonight on KPBS, Cancer, the Emperor of All Maladies, airs at 9 and continues tomorrow and Wednesday. Well, they're on cloud 9 today. 4 students from Vista High School found out what it was like to fly a Cessna aircraft. Vista High is the only school in San Diego County with the Aviation Honors Ground School. The program is offered through the Air Force Junior ROTC. On Saturday, students took an hour-long flight from Fallbrook Air Park with a volunteer from the Civil Air Patrol. One junior cadet says he was able to take over the controls at 1,000 feet after completing a full year of intensive ground training.
It's just an amazing experience, and I recommend lots of people to go out and pursue aviation, or at least, try and get the view, because it's unbelievable and it's something that you'll always remember.
I've never been in an airplane, and to be honest, I'm actually afraid of heights. And Colonel told me that he also is afraid of heights, but he says it's a beautiful experience, and I'm actually really excited to be on an airplane.
Students interested in taking the aviation course were able to experience the thrill flying as passengers as well. Some say it's hate speech. Gay rights groups are blasting a planned ballot measure in California that would authorize the killing of gays and lesbians. California Attorney General Kamala Harris asked a court last week to step in and allow her to block it.
It is literally threatening people with death, and that's something that people in the community take very seriously and very personally. I don't see how we couldn't.
The measure would need to collect more than 365,000 signatures to make it onto the ballot. The State Department of Corrections lifted some restrictions on where paroled sex offenders can now live. Peggy Pico explains who it applies to and its impact in San Diego.
Until now, Jessica's law, approved by California voters back in 2006, prohibited all sex offenders on parole from living within 2,000 feet of schools, parks, and other places where children congregate. Now, parolees not convicted of sex crimes involving children can live within the 2,000-foot parameter. Here with the details are my guests, Cal Western School of Law Assistant Professor Alex Simpson and Susan Fisher, former chair of the Parole Board and now legislative advocate with Citizens Against Homicide. And Alex, who does this change apply to, and when will it go into effect?
So the California Supreme Court came out with this decision a little bit ago. It would apply in San Diego County to about 400 or to 500 people who are currently on parole and convicted of a sex offense. And what the law says now is that those individuals may not be restricted in their housing to what Jessica's law said, the 2,000 feet of schools or parks.
And specifically, why not these particular 400 to 500 people in San Diego County?
So the court made a determination after hearing from law enforcement and from California Department of Corrections that in reality the reason why the law is in place is to try to make the community safer, and there was simply no evidence of that. In fact, there was evidence the other way that the people who were on parole who were subject to these restrictions had a harder time finding housing and were harder to keep track of because of the fact that they were subject to Jessica's law.
And I want to come back to that idea, but first, Susan, your background is in victims' rights advocacy and advocate. Why do you support this change?
Because it's a good change. It is, in fact, going to help parole keep track of sex offenders in a more effective way. When I was doing revocation hearings with the parole board, many of the people that I was working with were sex offenders who had nowhere to live because of the restrictions, who had nowhere to plug in their GPS so that we could keep track of them, and it made them less stable, which makes us less safe.
So less stable meaning you couldn't track them? They would be, what would happen to them?
Well, less stable in many ways. We couldn't track them if they couldn't keep their GPS charged, and we didn't have an address to locate them. But also because they're living under bridges and in culverts and in homeless camps, their access to drugs and to other issues that they might get involved with are more prevalent, and they're less stable, they're more angry, they're not taking medication if they need it, and it's putting us at a greater risk.
So logistically, Alex, hearing from that end of it, how did Jessica's law's restrictions here in San Diego County, how did that end up, where we just heard that a lot of people ended up maybe being homeless or on the run?
Yeah, the court heard testimony from a number of different law enforcement agencies who all testified that, for example, that the homeless population, the homeless percentage of individuals who were on parole and subject to these laws increased by 24 times after the enactment of Jessica's law. Some of them were living behind the alley of the parole office. Some of them lived underneath overpasses because all of them were subject to these restrictions. And that's really what the court was focusing on is, you know, if we really can't keep track of these individuals, for example, through Megan's law, then we need to make sure that the law doesn't have this restriction because it actually causes more problems than it solves.
Well, and Susan, coming back to this then, is there evidence that people who have committed sex offenses can be rehabilitated? I mean, they're on parole, they're out of the system, but as far as they're out of jail, I should say, or out of prison. So is there evidence that if you monitor them and they're more stable, that you can actually keep them from reoffending?
Well, I think it depends on what kind of sex offense you're talking about. Certainly some people who just were acting in a criminal way might be able to be rehabilitated. I think it's a different issue for pedophiles, and I don't know that we have evidence that we can rehabilitate them. But certainly we want to be able to keep track of them, and we can't do that if we don't know where they're living.
Well, certainly, and this does not, just to be clear, does not apply to pedophiles, anybody who's been convicted of a crime, a sex crime with a child. But San Diego County Supervisor Diane Jacob is very opposed to this change. She called it a travesty. She's said today that she called it outrageous. So let me start with you, Alex. What do you want to say to reassure people about public safety concerns, or if you want to reassure them about that, in response to this, that it's more dangerous for the public?
Yeah, let me just clarify. This is not really a position that the California Supreme Court was taking about Jessica's law itself. It really was just trying to determine what was the law meant to do. was obviously to promote public safety and make the community more safe, versus what the practical effects of the law are, which is that it makes the community less safe because it's harder to keep track of these individuals. So it really is not a kind of a comment on the law itself, it's just about the practical effects and the aspects of it.
All right, we are out of time. Alex Simpson and Susan Fisher, thank you so much.
Thank you.
Thank you.
I'm Judy Woodruff on the next NewsHour, a monumental documentary on the emperor of all maladies. I talk with Ken Burns and Siddhartha Mukherjee about cancer. That's Monday on the PBS NewsHour.
It's fairly easy to spot the newest addition to the San Diego Zoo family, a 2.5-week-old baby jaguar weighing nearly 5 pounds. Visitors have been flocking to the zoo since the weekend to get a peek. The cub made its public debut on Saturday inside the jaguar den. It's the third cub for the 7-year-old mother. Zookeepers will determine its sex tomorrow when they do another examination. Jaguars are the largest cats in North America, and their spots are as unique as our fingerprints, but their birth cycle is much shorter.
So about 3.5 months, and most large cats, and I believe even our domestic cats, are about 3.5 months. So we put her together with him from November 26th to December 3rd, and we knew we had that window between February 24th and March 23rd that she could possibly give birth, and she gave birth to one cub on March 12th.
Jaguars living in South America have weighed in as much as 350 pounds. Their numbers are declining in the wild because hunters sell their fur. They can live up to 20 years in the zoo. You can find tonight's stories on our website, kpbs.org/evening edition. Thanks for joining us. You have a great night.